So I'd like to introduce Luzia Travado, and we need a microphone over here for her because she's going to tell, she is actually a psycho-oncologist at the clinical center of the Champalimaud Center for the Unknown in Lisbon, Portugal. And Lucia, you've been very, very involved in the CanCon guide. I don't know if you're going to talk about that now, but you please do mention it so that everybody is aware of the part that rehabilitation plays in that.
Okay, thank you, Kathy. It's my pleasure to be here. I'm also past president of the International Psycho-Oncology Society, and we have been participating since the European Partnership on Action Against Cancer, which then evolved into the Cancer Control in Europe, in a number of projects that have the aim of improving and recognizing patients' psychosocial needs. As you know, cancer has a multifolded impact, so it does not only impact the physical domain, but also the psychological, the social, the sexual, the cognitive, the family, the professional, etc. So all these areas is what we need to address when patients face cancer. And in our area, the psycho-oncology area, what we face is that patients with a diagnosis of cancer, feeling the physical symptoms of the disease and the treatment, the side effects of the treatment, it disrupts their normal life, as you know. And so it creates what we have coined the term of distress, as to separate it from mental health problems, because a cancer patient does not have a mental problem. They have psychological suffering from reduced expectations of being healthy and not being able to do the things that they want to pursue. So we found out in the research that we have been doing since last century, since the 50s in the last century, that in fact distress impacts, severe distress that can go into anxiety and depression, does impact not only on the quality of life of the patient, but also on their clinical outcomes, such as survival. So the International Psycho-Oncology Society has put forward a standard in which distress should be assessed as the sixth vital sign after pain. So you know that pain took a long while until being recognized as a need that needed to be addressed. Also distress, if you don't assess it, as for instance with the distress thermometer, it will tend to go unrecognized, and patients usually do not disclose this suffering to their clinicians because they think, well, I have cancer, I have to suffer. And so they go on with this burden, this added burden of psychological suffering along with other suffering. So because we want to stop this, we have made a call for bringing distress to be assessed in clinical centers where patients are treated, to be assessed as the sixth vital sign, and also there should be resources of psychosocial care for patients so that these needs could be addressed and properly addressed. So when we discuss rehabilitation, and as Kathy was mentioning, what we wanted to do in CanCon with the European Guide for Quality Comprehensive Cancer Care, with a chapter of rehabilitation and survivorship in which we collaborated among other stakeholders with the European Cancer Patients Coalitions and other groups of stakeholders, is that rehabilitation is a patient's right along with treatment. So if the treatment is going to bring you side effects, we should not let these be left to the patient. It's our responsibility, the clinicians and the politicians, to take care of that side as well. So the concept that we introduced, not only in this guide, but that has been discussed, is that rehabilitation is not something to happen after the treatment, but pre-rehabilitation, before the treatment. So for instance, if we know that a surgery or a radiation therapy for prostate cancer is going to create a sexual problem, that should be discussed ahead of time with the patient and the couple. if the patient is interested in that, so that they can devise measures to cope with the problem and not be facing the problem afterwards and get depressed or isolated or whatever the reaction, the negative reaction acts. And while the lymphedema, for instance, in many centers, we have a preventive attitude with physiotherapy before the problem begins. And that's what we would like to make, is that rehabilitation is integrated part of a treatment. So when the treatment is planned, already all the areas that need to be addressed should be part of this plan. Now, what we have surveyed in EPAC and in the Euroship project, some projects that we surveyed the resources in this area in the different European countries, was that there are seldom resources of this kind. So as Kathy coined it, the patient is lost not only in rehabilitation, but in this transition, and most acutely in the transition from the treatment phase to the survivorship phase. So the patient does not know what to do, and it's left alone most of the times with all the symptoms. So we want this to stop, and that's why ECPC and ESMO, with the collaboration of the International Psycho-Oncology Society, have put down a survivorship guide for patients, so that there is the recognition of the areas that need to be addressed, so physical, psychological, social, sexual, cognitive, nutrition, to make a checklist of what are each patient's problems, and then what are the resources that need to be allocated to each patient, so that their survivorship can go smoothly and not stumble. So I have, because this is such an area of need, and it's not yet in the political agenda of our country politicians and ministries of health, we have to make a push for it. And I said to Kathy that I would like to make a manifesto action of some sort while we are here in this conference, or whenever appropriate, but we need to call for action in this area, because this is a much underserved area, and most of the countries do not have this in place, and so the patient really gets lost into this rehabilitation navigation. So hopefully we can discuss more about it, and we can do something together, professionals and patients and families and advocates, all together do something to move this forward. We have good guides, we have good recommendations in place, now we need actions. Thank you, Kathy, for the invitation.